Good afternoon, everyone. We now go into another sector that played a vital part during the pandemic and, of course, will continue to play a vital role as we go into the new normal. I'm talking about health workers, not just those in the healthcare industry, treatment, rehabilitation, but also preventive, diagnostic. The plight of health workers in the Philippines has been spotlighted during the pandemic because of the intense working conditions in fighting the spread of COVID-19. Long working hours, fatigue, depression. But in order to understand what happened, we have to go way back, not just what happened immediately before the pandemic, but going as far back as 40 years into the past. The Philippines has had a policy of exporting workers since 1974. Health workers are no exception. Now, the primary reason has been low salaries and benefits. There are other reasons, but arguably, all these grievances point to one source: inadequate funding. In 2019, the Department of Health study concluded a shortage of about 290,000 health workers, which is exacerbated by the annual migration of about 13,000 health workers. Among those who remain, most health workers prefer to serve in urban rather than in rural and depressed areas, meaning cities. Now, this is the legal framework before the pandemic, and this is still the prevailing legal framework. For private health workers, their rights and minimum benefits are the same as other private workers. The minimum wage is determined per region. So health workers performing the same duties will have different wages because the minimum wage required of employers differs per region. Now, this means that in urban areas, since the cost of living is higher, then wages are higher. Metro Manila, NCR, National Capital Region, has the highest minimum wage. Of course, rural areas will have less minimum wage. Now, for public health workers, the Magna Carta defines the allowances and benefits that can be granted to them. As for compensation, public health workers are included in the schedule of all government workers, salary standardization law. And the government granted a series of salary increases. However, even among public health workers, the compensation is not equal because health workers employed by the local government have less compensation. One, local government units historically, and let's put a pin on that, I will go back to that later. Historically, LGUs have had less funds compared to the national government. Number two, legal. The local government code imposes a maximum percentage of the local government budget that can be assigned to fund compensation of all local government workers. Now, as for nationally paid health workers, the health-related establishments which engage their services are not fully funded in the annual budgets. And so they must rely on savings, which is not adequate to cover the mandated benefits under the Magna Carta. And lastly, barangay health workers. Barangays are the basic level of communities in the Philippines. They are not treated as employees. They are treated as volunteers and therefore they are not entitled to a regular salary, but an honoraria. Once COVID-19 started spreading, the filling up of hospitals became inevitable. There was a computed pre-existing shortage due to overseas migration. And so that impacted the staffing patterns in hospitals and health-related establishments, leading to longer hours of work, fatigue, and depression. And then hospital workers also fell ill as they had to be quarantined, and all their colleagues exposed to them had also to be quarantined. Then that made the effects of the shortage worse. In addition to those considerations is also the amount of salaries. The amount of salary should ideally be equivalent to their work. Now, all health workers are performing comparable duties, regardless of jurisdiction. But as we see here, the salaries of health workers in the Philippines are way lower than their colleagues, at least here in the Southeast Asian region. I did not include here salaries for health workers in the Middle East, the Arab countries, in the United Kingdom, in the United States. Filipino health workers, at least here, nurses, medical technologists, had a monthly salary less than their foreign-based counterparts. In order to stem the tide of overseas migration, the government temporarily suspended overseas deployment of health workers in 2020. It later allowed, for 2021 and 2022, overseas deployment of nurses only, choosing instead to impose a cap. Nevertheless, nurses continued to leave the country to work overseas. I showed the salary earlier. That's one motivating factor. And that has been the historical motivating factor for health workers to migrate. In addition, 200 to 250,000 registered nurses chose to leave the profession entirely, not practicing anymore. The urban area concentration of health workers remains. And then lastly, barangay health workers, treated as volunteers, were assigned to do contact tracing of COVID-19 patients. Yet again, they were treated as volunteers, only entitled to honoraria. And their honoraria differed per city or municipality. The government of the Philippines enacted a law providing for a COVID-19 special risk allowance, mandating that the National Health Insurance System, PhilHealth, cover all medical expenses of health workers who contracted COVID-19 or any work-related injury or disease during the state of emergency due to COVID-19. Plus compensation, 1 million for health workers who die of COVID-19, 100,000 pesos for those who contract severe COVID-19 infection. Now, all these were codified in a law that will apply to all public health emergencies, not just due to COVID-19. The special risk allowance became health emergency allowance, whose amount differs depending on the level of risk, not a flat rate. For those who contract a mild or moderate case of COVID-19, those health workers would also be entitled to a compensation of 15,000. Regular testing of healthcare and non-healthcare workers as often as necessary. And then there has also been an increase in minimum regional wages. Again, regional, not industry-wide. For public health workers, the salary increases 2020, 2021, 2022 continued. Now, these are the 2022 rates, those in bold, they are still much less than the figures earned by their counterparts in the Southeast Asian region. How do we convince health workers to stay on in the Philippines? The government has to address the entire compensation system in order to stem the tide of migration. Health workers must be compensated not just to stay in the country, but to be assigned to rural areas outside of capitals or centers. So, the need of an industry-wide minimum wage, whether they are in the public or private sector, whether paid by the national or local government, whether in urban or rural areas. Barangay health workers must be granted salaries and not just honoraria. They were especially put at risk for contact tracing. A national industry-wide minimum wage, as I've said, and then the non-salary monetary benefits must be made uniform for both private and public health workers, increasing the rates currently prevailing in the Magna Carta. Now, there may be challenges of preferring health workers over all other workers. Why give them higher benefits when everyone has been affected by the pandemic and by the continued economic problems in this new normal? Philippine law, as interpreted by our Supreme Court, allows classification based on a reasonable foundation or rational basis and is not palpably arbitrary. So, there is a room for argument that health workers have the duty of saving lives, difficult working conditions, and the consideration, again, to convince them to stay in the country, and particularly in rural areas. These can be bases to argue for different treatment of health workers, for increasing their compensation and allowances relative to all other workers in government and in the private sector. To support that argument, the statistics on migration and the amounts of salaries that they have received per region compared to other jurisdictions, these may be cited. And then finally, the Constitution's policy to promote the right to health of the people and to instill health consciousness among them. And then a uniform salary schedule that would be separate from all other government workers. Now, this is for the public sector. I've discussed the 3 points earlier. Let me go to the last point. This is not new. Government agencies have been exempted from the general government compensation system, the salary standardization law, in order to be competitive with the private sector. If these agencies can be treated differently from other government workers, then all the more reason health workers should be so similarly treated. Now, I said earlier that local governments have historically received less funding compared to national counterparts. However, the decision of the Supreme Court in Mandanas versus Executive Secretary has resulted in an increase in the internal allotment of local governments. With this increase in funding, it is more likely that they would be able to fund full payment of salaries and Magna Carta benefits of local government health workers. The sources of funding can be from excise taxes on tobacco, alcohol, sweetened beverages, and other health-related revenue sources. And then professional fee reimbursement from the National Health Insurance System, the PhilHealth, and also funding from other sources. This is from my video on my YouTube channel, Emir's BTIN. I talked about how the Bill of Rights is not enough. And I said one line there that can be applied here. There must be an automatic mechanism for recognition of rights. This includes increasing these rights, particularly for health workers who play a vital role in saving our lives. Thank you very much, and mabuhay.